You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Joining us right now, Dr. Oliver Brooks. He's president of the National Medical Association. He's a pediatrician in Los Angeles. In addition to that, he is the chairman of the Immunize LA Families Coalition and a board member of the California Immunization Coalition. Dr. Brooks, glad to have you on Roland Martin Unfiltered.
Good day to you, Martin, and enjoying your program thus far in the comments.
As a doctor, I mean, how do you assess what has happened thus far in terms of how the federal government has responded to this coronavirus pandemic?
I will say that the response that I saw yesterday did not engender confidence. A lot of what we deal with as physicians is the patients, those we treat, have to have a confidence in us. So what I got from our commander-in-chief was not confidence. He let go Tim Zimmer, who was the National Security Advisor individual for public health and natural disasters. He wasn't replaced. Tom Bossert, Homeland Security, who was big on diseases, pushed out by John Bolton, not replaced. So now what we're dealing with is we're scraping together a response. We have not had a state of emergency declared. State of emergency declared would allow for other funds to be released, and there's some funds like myself in the community health centers that specifically in a state of emergency. So now what I'm dealing with is a lack of tests, patients that have a lot of concerns, and I'm challenged to treat them properly. Also, at the end of Masons, we look at the health and the welfare of the African American community and communities that are underrepresented. We have to be concerned about things like if it gets strongly into the African American and poor communities, poor transportation, public housing, so we're living all on top of each other. Not great access to healthcare. So I'm sick. Not only may I not go to the doctor because I have to go to work, but I may not go to the doctor because I can't readily get to a doctor. The studies have shown clearly from the CDC that those that die from this are those that have comorbidities. So we, of course, as African American.
First of all, what is that? First of all, what's that phrase? What is that?
A comorbidity, just if you have some other illness, like in addition to you may have fever and may have been exposed to someone with COVID-19, you also have hypertension, COPD, pulmonary lung disease, diabetes. All of these things put you at higher risk of complications and or death from coronavirus. So if or when this hits the African American communities that are poor, underrepresented, it will devastate us. So that mortality rate that our leader told us, oh, don't worry about it, I have a hunch that it's not as high. And in the Black communities, if COVID really starts to spread, the morbidity rate will be, in fact, high.
But Doc,
concerned about that.
Doc, but here's the thing that I think is just so basic. Don't you, as a doctor or as a public health official, this whole notion of want to keep numbers low, don't you want to know exactly the extent of the problem to then know how do you treat it? How do you actually begin to fight this thing? Where is it strong? Where is it weak? I mean, so without data, you're just flying blind.
So you're absolutely true. The 11,000 tests that have been done in this country equal to the how many are done a day in other countries like Korea is unconscionable. We work with data. So once we get the information, we know this many people are testing positive. We get a better understanding of the asymptomatic spread. How many people actually have it that have no symptoms? The ages of those that are getting it. We need the tests. I don't know what to say. We were offered the tests. The WHO offered the test to the United States. United States said, no, we'll figure it out. Then they released the test, and the CDC found that they were faulty. So
No, hold on, Doc. I want you to go over that again, because people don't realize that. The World Health Organization, They have been following this since the outbreak in China, other countries. They
Correct.
offered the United States exactly what?
A test reagent that could be utilized immediately to start running tests and in large numbers. That was in January.
And the United States said, no, we'll figure out our own. And the test.
We'll get our own tests going. We'll get it run properly, coming out of FDA and CDC, and disseminate it.
And the World Health Organization offered that to all countries. They said, we're going to give you all of the backup data and everything, but arrogant United States of America says, no. Donald Trump, we got the best people. We'll do our own. And now what they discovered is that test is faulty.
Well, it was faulty. It's now no longer faulty. But the point is, when you're developing your own test, it takes time.
And that was critical time that was wasted because you need to be on top of this thing from the beginning.
So right now, it is like you are building a plane while you are flying it. And it is a very uncomfortable situation.
Wow.
Up until 2 days ago, I couldn't even do a test unless the LA County Department of Public Health approved it because they had so few tests. Now I have found out that I can start testing more widely. So I feel more comfortable now, but now we're behind. And this is one of those things where catching up ultimately can be deadly. So it's not like in a basketball game where when you get to the end, you won 99-98, even though you're down by 12. This is one of those when you get to the end, you look back and there is a field of bodies behind you because you were not able to get the information out, to test, to monitor, to understand better this disease. He hasn't declared a state of emergency because he's concerned that it'll contradict the message.
So now, Doc, we've seen cities and states do that. If the president declares a state of emergency, what does that mean? What does that now look like?
So what it would mean is that FEMA would then take control over the response, number one. Number two, it releases specific monies. Some of the monies that they're earmarking are either extra spending or they're being taken from other areas. A state of emergency changes the whole approach. The federal government is now in charge. That hasn't happened. He says it's because this is like seasonal flu. But let's underscore the fact that right now, Tom Hanks and his wife tested positive. Where are they now? In Australia, where it is late summer. The other thing, if you think about it, WHO declared a pandemic. So flu can be a pandemic. It's not now. Flu is a disease that we see every year seasonally. But there have been pandemics of flu. So he could say it's like seasonal flu. If he says like seasonal flu, that is a pandemic, then the response is totally different. But we're not there yet.
And Doc, so, in fact, Tom Hanks and his wife were tested in Australia. Had they been in the United States, they would have not have qualified according to the testing rules.
And that is actually correct. So again, we underscore testing. That is what will get us to where we need to be. Again, my staff even now are somewhat concerned because we just don't know. We can't, when we have someone where we have a level of suspicion, I'll run the test. It costs $20. Maybe it comes back in somewhere. Now the time changes too. It was 2 to 3 days. Now I'm hearing it's a day. But now when we can test, then we can allay people's fears. We can monitor. We can isolate. Basically, the approach is identify, isolate, and quarantine. That's the response to a public health infectious disease condition. And right now, the difficulty is identifying.
Right.
You can't really identify them.
So again,
that is our challenge right now.
As you said, you're building a plane while you're flying it. Dr. Oliver Brooks, President, National Medical Association. We appreciate it. Thanks a lot.
All right, thank you very much.
Folks, again, one of the reasons why this show matters is because we want to, again, utilize our black health experts so you understand exactly what's going on. Doctors you know who you can trust, providing you the kind of information. So, all right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike other, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to rolandmartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's rolandmartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at rolandmartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it.